Good morning, sir. I am Anwar Baildi, and I'll be demonstrating hand routine and finger routine. So I'll be demonstrating the finger routine first. So first, let the patient sit at the end of the table with forearm resting on the table. So the clinical indication for this is first fractures and dislocations of the distal, middle, and proximal phalanges. Second is pathologic processes such as osteoarthritis and osteomyelitis. So the technical factors of this is SID should be 40 inches, which is 102 centimeter. Second is the IR size should be 18 by 24 centimeter, which is 8 by 10 inches. So third, the KVP should be 55 to 60 KVP. No grid required, and the collimation is on four sides of the affected digit. So part position, first hand pronated with palm flat on the AR. Separate fingers slightly and center the third digit to the IR. And long axis of finger aligned with long axis of IR. And the central ray is perpendicular to the PIP of the third digit. So the central ray is perpendicular to the PIP joint of the third digit. And entire digit and distal metacarpal must be visible, equal concavity on both sides of the phalangeal shafts, and open IP and MCP joints without overlap. And no motion, soft tissues in bony trabeculae are clear. So next is the PA oblique projection. So first is patient must be seated with hand resting on the IR. So the clinical indication for this is fractures, dislocations, and pathologic conditions of the phalangeal joints. The technical fractures, SID must be 40 inches. And the IR size is 18 by 24 centimeter. The KVP is 55 to 60 KVP. No grid and collimate to affected finger and distal metacarpal. So part position, need the wedge. And the CR is perpendicular to the PIP joint of the third digit. So rotate hand laterally 45 degrees from the PA position. Center the third digit to the IR. Separate other fingers to avoid overlap. So next is the lateral projection. Sit patient with elbow flex 90 degrees with hand resting on IR in a lateral position. So the clinical indication for this is same as the PA projection, and the technical factors is SID 40 inches and IR is 18 by 24 centimeter. So place the third digit in a true lateral position. Adjust the other fingers into a fist or use a sponge to isolate the middle finger. Align the long axis of finger with IR. The CR is perpendicular to the PIP joint to the third digit. So, true lateral position shown by concave anterior surface and convex posterior surface. Open IP joint space and no superimposition of adjacent digits. So next is the hand routine. So I'll be demonstrating the PA projection first. So sit patient at the end of the table with hand and forearm extended. The clinical indication for this is fractures, dislocations, and foreign bodies of the phalanges, metacarpals, and all joints of the hand. Second is pathologic process such as osteoporosis and osteoarthritis. The technical factors for this is SID 40 inches. The AR size should be 24 by 30 centimeter. The kVp should be 60 to 70 kVp. No grid, and the collimation is on 4 sides of hand and wrist. So, part position. Palm flat on IR with fingers slightly separated. Long axis of hand and forearm aligned with long axis of IR. So, CR must be perpendicular to IR and directed to third MCP joint. So, entire hand and distal 2.5 cm of forearm visible. Equal concavity of shafts of metacarpals 2 to 5, no rotation. Open MCP and IP joints, no motions, and sharp bony trabeculae and soft tissue margins.
1, go.
So next is the PA oblique hand projection. So patient should be seated with hand resting on IR. The clinical indication for this is fractures or dislocations of metacarpals and phalanges. Second is pathologic processes such as osteoarthritis. Technical factors is SID should be 40 inches, the IR size should be 24 by 30 cm portrait, kVp 60 to 70 kVp, no grid and collimation on 4 sides of hand and wrist.
3, 2, 1, go.
So part position, rotate hand laterally 45 degrees. Use wedge punch to support hand and keep fingers parallel to IR. Spread fingers slightly like this. And CR is perpendicular to IR and directed to the third MCP joint. So 45 degree oblique evident by slight overlap of metacarpal heads 3 to 5, no excessive overlap, entire hand and distal forearm included, no motion, clear trabecular pattern. So for my last projection, which is the lateral projection, the extended lateral, the patient position for this is patient seated at the end of the table with forearm resting on the tabletop. Clinical indication for this is fractures and dislocations of the hand and wrist, localization of foreign bodies, demonstration of anterior or posterior displacement of fracture. Technical factors is SID 40 inches, which is 102 cm, IR size 24 by 30 cm, which is 10 by 12 inches. kVp is 60 to 65, and no grid required, and collimation is include entire hand and wrist. So part position, place the hand in a true lateral position with the ulnar aspect down. Fingers extended and superimposed with thumb placed parallel and slightly anterior to the hand. Align long axis of hand and forearm with the long axis of the IR. Ensure the hand is not rotated. Verify by the imposition of metacarpal heads. And the central ray is perpendicular to IR, directed to second MCP joint. Like that. So superimposed phalanges and metacarpals indicate a true lateral position. Thumb slightly anterior to the hand and free of superimposition. Distal radius and ulna superimposed. No motion, sharp bony, trabecular, and soft tissues margins visible.